Hi, Dr. Hike. Regan Bristol here, and I am presenting the Clinical Practice Guideline project on neck pain. So the purpose of this review is to describe evidence-based physical therapy practice, including diagnosis, prognosis, intervention, and assessment of outcome for musculoskeletal disorders related to neck pain, commonly managed with orthopedic physical therapist techniques. Some additional purposes that were stated: to classify and define conditions related to impairments of body function and structure, activity limitations, and participation restrictions. So kind of talking about the ICF. To identify interventions, identify appropriate outcome measures, and assess changes, provide information for patients, payers, and claim reviewers, and to create a reference publication. Pros of the CPG, it involved a high-level systematic reviews using updated criteria for levels of evidence. Summary recommendation and grade of evidence for each topic addressed in the guideline was from 2008 until 2017. Specific components of medical screening, evaluation of clinical findings, determination of the condition stage, and interventions were all provided. There are also multiple appendixes available for reference. Some of the cons of the review: at times it was tough to follow due to the surplus of information and differences between the guidelines provided. Actual prevalence could not be reported due to the wide variation of neck pain and conditions. Predominantly focus on pain and ignores other symptoms associated with these conditions. Particularly, it did not include anything regarding biopsychosocial. Jumping into the Agree tool, I separated this by domain. So domain 1, scope and purpose, scored an 18 out of 21. The overall objectives of the guidelines specifically described, 5 out of 7 because there were multiple purposes listed, but they are broad in terms of neck pain, and it was hard to distinguish which of the objectives is the main focus. The health questions are covered by the guideline are specifically described, 6 out of 7. These were not in question format, but they did provide target population interventions, comparison, and outcomes that were all addressed. Population to whom the guideline is meant to be applied is specifically described. This got a full score, 7 out of 7, because the population is clearly stated and specifics were provided to address all aspects of neck pain, including the severity and additional symptoms. Domain 2, stakeholder involvement, another 18 out of 21. The guideline development group includes individuals from all relevant professional groups. This was clear and concise. The list was provided, so it got a 7 out of 7. The views and preferences of the target population have been sought. This was a 4 out of 7 because it wasn't necessarily clear, but there is information in the methods regarding the development of the guideline itself. The target users of the guideline are clearly defined. This got a full score, 7 out of 7, because specifically mentioned to orthopedic physical therapy clinicians, academic instructors, clinical instructors, students, interns, residents, and fellows regarding physical therapy. Domain 3, the rigor of development, this got a 42 out of 56. Systematic methods were used to search for evidence, full score because of they were very clear about the search terms used for the systematic methods. Criteria for selecting the evidence are clearly described, 6 out of 7. This was definitely stated, but it had to be found in an appendix with no link. Strength and limitations of the body of evidence are clearly described. This was a 6 out of 7 because there was a clear list of limitations provided, but the strengths were not as obvious. Methods for formulation and recommendations are clearly described, 7 out of 7 because the guideline review process and validation was clear in the methods section. Continuing with domain 3, the health benefits, side effects, and risk have been considered in formulation of the recommendations. This got a 3 out of 7 because it wasn't exactly clear. Some side effects were stated, but they were mostly poor and could be expanded in more detail. Explicit link between the recommendations and supporting evidence, 6 out of 7 because there was a summary recommendation and grade of evidence included. And although the list of recommendations were provided, the links between the two could have been more concise. Guideline has been externally reviewed by experts prior to its publication. This was a 1 out of 7 because there was no information regarding external reviewers. Procedure for updating the guideline is provided, 6 out of 7 because this was defined and stated, but it was slightly challenging to find. Domain 4, clarity of presentation. Recommendations are specific and unambiguous. This is 6 out of 7 because they were definitely clearly provided, but it could use clarity when following multiple recommendations that were stated. Different options for management of the condition or health issue are clearly presented. Again, 6 out of 7. There's strong components of medical screening, evaluation of finding, condition stages, and intervention stated, but they could be more concise. Key recommendations are easily identifiable, 7 out of 7. The recommendations stayed consistent and clear throughout the entire guideline. Domain 5 got a 13 out of 28. Guideline describes facilitator and barriers to its application, 3 out of 7 because the facilitators were not clear. There was information on barriers, but no strategies for overcoming these barriers. Guideline provides advice and or tools on how the recommendation can be put to practice. 7 out of 7. There was a clear list of implementation tools and strategies that were stated and understood. Potential resource implications of applying the recommendation have been considered. 1 out of 7, because there was no information provided on potential resource implications in applying recommendations, and there was no identification of costs or information regarding costs. Guideline presents monitoring and or auditing criteria. 2 out of 7, because there was a minimal information about monitoring provided, but there was no information about audit criteria. Domain 6, editorial independence. This got a full score of 14 out of 14. The views of the funding body have not influenced the content of the guideline. This was a 7 out of 7. The funding was mentioned for traveling expenses for clinical practice guideline training and development, which was also stated that it did not influence the actual clinical practice guideline. The information was clearly and easily found in the disclosure section of the review. Competing interests of the guideline development group members have been recorded and addressed. Again, a 7 out of 7. This was very clearly stated towards the end of the review. The overall assessment, I would give this a 5 out of 7. It was very thorough with clear and concise recommendation explanations. They had very useful appendixes that were easy to find, but I do think it was a bit confusing with the surplus of information regarding specific medical screening, evaluation, and determination of the stage of condition. I think that this stems from the challenge of differentiating the general condition of neck pain into its specific several categories that it can be distributed in. Would I recommend this guideline? Yes, I would. With modification, I would recommend this guideline for evidence-based practice with modification. I think it would be a more condensed version of the clinical practice guideline would be more useful than the full explanation in the review. Further supportive information could be provided, especially involving health benefits, side effects, and risk. I also think that because neck pain is such a complex condition and depends on how many aspects of the patient is presenting with, that the clinical practice guideline would be more useful to bring direction to a treatment rather than being the entire main focus. And I think that's really important for us to consider as physical therapists. And then here are my references, and thank you.